Welcome everyone. Great to have you with us. My name is Tony Rimanier. I'm joined by my colleague Alexandre Vaz, who is here as well. As you join, Neha, excellent. Welcome from India. Great. As you join, please enter your location and models of therapy in the chat window. Usually we have a pretty wide range of diverse participants. So today's focus is going to be on solitary deliberate practice, how to do it. And we're going to spend most of the time actually watching a demonstration by Alex, who's here. And so you're going to see video of Alex doing solitary deliberate practice, and you're going to be able to ask him questions in the chat as the video is playing. So it's really exciting. And I'm just going to facilitate a discussion among you all. So we're going to move pretty quickly through deliberate practice. In fact, we're going to spend almost no time talking about deliberate practice itself, just because we don't have time for that. There's lots of resources on deliberate practice, kind of deep dives into it, and other webinars at our website, dpfortherapists.com. And so, this webinar is going to be recorded and it's going to be posted on YouTube. So please, if you put in the chat window, just don't include any confidential client information or anything you want to keep private or anything like that. So we've got a whole series of webinars recorded on our website. These are growing. Every few weeks we're adding another. So please visit dpfortherapists.com. So deliberate practice has 5 components shown here. The 2 components we're going to be focusing on the most today are setting small learning goals and behavioral rehearsal. These are the 2 components that are often the trickiest for people who are new to deliberate practice for psychotherapy. Now, Alex has talked about this in previous webinars. Broadly speaking, there's kind of 2 types of deliberate practice exercises for psychotherapy. There's generic exercises, meaning the exercises work for a whole range of people. Like we've got these kind of exercises coming up in our books. You can practice them as a group. And then there's personalized deliberate practice exercises. These are exercises that are customized specifically for your personal skill threshold, your personal learning style, your personal difficulty ranges. These can be assigned by a coach or by yourself. Now, solitary deliberate practice, this is how we do it. We start with a video of a client that the therapist, or trainee, yourself, finds challenging. You don't need a video. You theoretically could have just session notes or process notes or something like that. We found, and there's been a fair amount of research showing that session notes, process notes, miss a lot of what's going on in therapy, even if the therapist is trying as hard as possible. I watched a video of myself the other day where I distinctly remembered doing something which in the video I didn't do. My memory added it post hoc to the video. So the video is really, really important, though I know it can be challenging for some people to get consent. We actually have a 2-part webinar series just on videotaping therapy. And so I recommend you watch that if you have any questions about that. That's on our website. So you're going to get a video of a client that you find challenging. Then you're going to rehearse specific skills that are identified by your coach or by yourself. We're going to talk more about that. We're going to aim to do at least 5 rounds. Which will cover maybe 5 to 20 minutes plus or minus. We want the exercise, the deliberate practice, to feel challenging and effortful and rich and rewarding. Sometimes that happens quickly, like in 10 minutes. Sometimes that takes a half hour or more. we're going to use two forms which are available on our website to kind of guide the practice. The first is the reaction form. That's the lower one here. And that's going to guide you in terms of determining, is the exercise challenging enough? Is it too easy? Is it too hard? It'll also be building your self-reflective capacity as you do the exercise. The second form, the deliberate practice diary form, is something you're going to fill out either during the exercise or after the exercise. And this will help inform what to do next. You can give it to your coach. You can keep it for your records, that kind of thing. And by the way, if you have any questions while I'm yapping, please go ahead and type them in the chat window, and Alex will be happy to address your questions live. So,
no topics are off topic.
No, yes, everything is on topic. So, one of the biggest challenges in deliberate practice for psychotherapy is, how do we pick skills to focus on in deliberate practice? Now, there are what we call more generic or common factor skills that apply across all models of therapy. Though they're talked about in a number of books, Scott Miller's talked about them a lot, Bruce Walpole's talked about them a lot. There's a great book here on the page by John Norcross and Michael Lambert that talks about a bunch of skills. These are the skills that have been identified by research to be most strongly associated with positive outcomes in therapy. So these are always kind of good, kind of quote unquote safe, appropriate skills to work on kind of throughout a career. Many therapists will find that even when they feel confident in these skills with many clients, another client will show up at some point and they're like, wow, I really don't know how to do like empathy with this client for whatever reason. And so you can rehearse that skill again. Another option is to pick a skill from a specific model of therapy, right? We are producing a series of books that will each have 10 to 12 or more specific skills from the model of therapy. So for example, from the EFT book, our first book, one of the first skills is empathy in an EFT context. And so you could work through the skills in the book. Another thing you could do is focus on skills that are identified by your coach, who's reviewed videos of your work and is spotting your blind spots, or by yourself. You could just self-identify like, wow, I'm having trouble I'm having trouble talking too much when I'm with this client. I just noticed that in my videos. So I'm going to practice talking less. Okay, so let's jump in. What we're going to do here, hold on one second, is...
And by the way, thank you, Heidi, for the question that you asked before. So what, yeah, just to say to everyone, so when Tony meant 5 rounds or 5 rehearsals, this would span for 10 to 20 minutes, right? No problem.
Yeah.
Any question you have of anything you see on the video, feel free to write in the chat, and we're happy to talk about it.
Yes. Okay, so Alex was generous enough to record videos of himself doing solitary deliberate practice. There are 5 sections, and we'll start with the first. And let's, actually, I want to make sure I shared the sound on this. Now, as this plays, feel free to ask questions in the chat.
All right, so I'm about to embark on a solitary deliberate practice session. Just to fill you in, so I have chosen to focus on a client that unfortunately is struggling with suicidal ideation, and I've been struggling with not coming in to the rescue, basically. So I noticed as I was rewatching a video of myself giving a session to this client that I do feel a great urge to, you know, advise behavioral modification, advise with change strategies, just really just coming in, I would say, too strong without just sitting with the client, empathizing, validating, and just deepening the experience that's in the room. So I noticed myself as I was watching the video of myself going a little bit away from what was actually happening in the session. So I decided to focus on that for this solitary deliberate practice session. So my objective is to watch a segment of that videotape that I have with this client. And I chose about 20 to 30 seconds, an excerpt from that videotaped session, my last session with this client. And I'm going to try, instead of following my typical urge to want to talk more or to want to change something, I'm going to try to slow down a little bit and empathize and validate the client's experience. So just trying to stay with the client's experience. So I'm going to also be tracking how that's going for me with our delivery practice reaction form. And I'm going to do a couple of rounds and see how that goes. So I'm going to pull up the audio clip, the video of the session here, and I'm going to just watch 20 to 30 seconds, 20 seconds now. Okay, wish me luck. Okay, so I'm going to try now to answer. Yeah, and I can hear that this is so hard, that you've been feeling this for such a long time now. And I can really imagine how exhausting it must be after all this time to still be feeling this. Okay, so I'm gonna head to the reaction form. And I would say that this is about a 6 or 7, answering how challenging does it feel to do the exercise. I'm somewhat satisfied, but I can feel a lot of reactions. So I could feel some body tension coming up. I could notice my own sighing, a little bit of increased heart rate. And especially, I do have an urge to come in and want to change. I want to advise this client to do something different, right? Or to focus on something different. So I can still feel that struggle. So I would say that in terms of difficulty, I'm at a 6 or 7 on this first try.
Great. So why don't we take a look at the reaction form that Alex was just completing. So you'll notice the first question is, how challenging does it feel to do this exercise? And he marked between a 6 and a 7 here, and that's in the good range. And then under what reactions did you have to this exercise, he circled body tension, size, increased heart rate, changing focus. And those are all under the good challenge. So this means he's got a good focus, good skill, it's at the right difficulty. There's all green light to continue ahead. Now, if his difficulty was above an 8, that suggests it might be too hard. Or if he had any of these reactions, it suggests it might be too hard. Now, this really differs for each individual, so it's kind of up to you to decide whether to persist or whether to make it easier. And if you download this form from our website, there's instructions on how to make it easier. Now, if he had marked it as too easy, below a 4, or if he didn't have any reactions here, if he was just sitting there like, wow, this is just like totally boring, then it might be too easy. And then he'd want to follow the instructions to make it harder. So I would like to jump right into the next video. And let's see, we're going to do round 2 here. And if you have any questions, please type them in the chat window. Here we go, round 2.
I'm feeling compassion for past Alex. He's really trying something.
Yeah, excellent. Excellent.
Okay, so I'm going to watch the same clip again and try again, the same exercise. Yeah, I can really hear that you've been struggling with this for such a long time. And also that you've been trying so hard for so long to try to feel different or for things to get better. It seems you're still not getting what you need, right? So after all this time, it just feels like you're not getting what you want. You're not getting what you need. Okay. All right. So looking here at the reaction form, I'm still, I think, at the 6 or 7. I can still feel, I could notice still myself sighing. I can still notice the increased heart rate. I can notice some anxiety going through my body as I'm tracking this client, as I'm watching him talk about these symptoms, about his lived experience, I should say. I do feel anxiety going through me. But also I could feel a bit more nuance. I could feel the sadness and get in touch a little bit more with my sadness, echoing his sadness. And I really enjoyed saying this last piece of him not getting what he needs or what he wants, right? So that feels important. It feels like I'm staying with his experience and deepening it a little bit. So still a 6 or 7, still think I should repeat the exact same thing, but feels a little bit better.
Great. So let's see, we got 2 questions here. So Jenny wanted a better sense of how Alex had been looking, sounding compared to these practices. Unfortunately, we do not have this. Alex, how would you answer that?
That's a good question, Jenny. I think if you were to watch the videotape that I'm watching, that I'm using as a stimuli, you would find me either subtly trying to influence the client in a direction that I would want out of my own anxiety. So you'd notice myself really asking, like, so what have you been doing? Because you're feeling this. So, like, really trying to move forward in a way. So you'd see the direction I'm taking differently. Or you'd see myself not really echoing, I think, so directly what I'm seeing and experiencing. So just blocking and freezing a little bit. So unfortunately, I can't really show you that clip for confidentiality reasons, but you'd find me fumbling differently than I am here, I think.
And Joseph asked, I'm curious how to determine what is a skill, especially at the level of specific therapies rather than common factors. At what level of abstraction are we looking? How granular or broad might we be to decide what is a skill to be practiced? Thank you. I might take that one, Alex, if that's okay. So I would suggest aiming for a skill that you feel motivated to get better at, that you think will help the client more. Now, I know that's kind of a vague answer, and unfortunately, that's the state of our field. You could line up 10 world experts in psychotherapy process, and they would all answer this question differently. So there's quite a debate going on about what are skills in psychotherapy. So I would say, trust you. What is your gut telling you will help this client more? And the good news is you'll find out. You'll rehearse it, and then you'll sit with your client, and it'll work or it won't work. And then you'll get information to do it, to try something else. And it often has taken me a few weeks or even longer of different rounds of deliberate practice, focusing on different skills until I figure out what is actually going to help the client the most. I can give you an example. There was a client who was not doing well in therapy, and I got advice from one supervisor who gave me a set of skills, and I rehearsed those skills, and it didn't help at all. In fact, the client might have even gotten worse. And then I tried something else, and that didn't work. And at one point, I got feedback from the client where the client's like, you're smiling more today. It's really nice when you smile. And I was like, and it just kind of stuck in my mind. And so I actually practiced sitting with a video of the client and just smiling more. Like while I was going through therapy, while I was talking about things, just smiling more, like being happy. You're not forcing myself to be happy, but like accessing my joy while I was with the client. Because I realized I had gotten into just being very serious and very flat and very stale and very like, just very therapist-y, you know? And it totally helped. The client was like, this is great. Like it actually really, really helped him. And that took a few months to actually figure out. So, you know, they say the best supervision we get is from our clients. So, all right, let's go ahead to the next video. So here's round 3.
All right, round 3. Let's go. Yeah. Yeah, this is really sad. This is really sad. After all this time, you're still not getting what you want. You're still not getting what you need, right? So, reaction form, I feel much better actually. I'm really sensing a shift inside. I'm at about a 4 or 5 in terms of difficulty, and I'm much less anxious, and the urge to want to go away, withdraw, or change the focus, come in advising, I can't feel the urge so much right now. I feel much more tuned just with the sadness and being able to stay with that experience. So I feel really much better about it actually. Yeah.
Great. So again, please put your questions in the chat window if you had any. These are great questions from Jenny and Joseph. Something I want to highlight here is you'll notice Alex is kind of doing it differently each time. He's basically practicing improvising. You know, therapy is an improvisational art, right? Memorizing canned lines does not work. I can tell you that from experience. So what he's doing is he's kind of stretching his range. It's not about finding the right way to do any particular skill. It's about exploring your range. And then as he does this, he's having all kinds of different internal experiences that you can't, I mean, did you predict this? Did you know what was going to happen, Alex?
No, not at all. What I can say, this is also a good learning point to talk about state-dependent learning, meaning like without the practice, I would fall into the same kind of urges and same kind of interventions when faced with the stimuli, right? So what I'm doing is I'm actually kind of flexibilizing my repertoire. So when the stimuli appears, and now I have data on that, because what's funny about this is that then you can videotape your next session and see how different it is. And it was very different. Actually, I don't want to give any spoiler, but spoiler alert, it was very cool that the session afterwards, I did get the feedback from the client that they felt it was quite a special session, that they felt that we were able to stay in a place that they really wanted and needed to stay with. So that was very validating. I could have totally missed the mark, and that happens all the time as well. But in this case, it really helped me to have that repeated experience.
Great. Let's just jump into the next round.
Oh, just to answer Vidar, yes, I'm
Yes.
always using the same segment of the video because it's the most evocative that I did find. So I found it consistently good to repeat.
Yeah, that's a really great question, though. So you might find that you want to focus on the same section and repeat it again and again if it's a particularly hard section. You also might just want to let the video play and just practice while it's playing. So they're both valid. The goal is to get to what Alex described, which is the state-dependent learning. So this is round 4 of deliberate practice. So he has been filling out reaction forms after each round. We're just not showing all of them, you know, for time purposes.
So round four, I noticed that since I'm feeling a lot more grounded and it's starting to feel a bit easier what I was doing before, I want to switch to an intrapersonal focus. And I'm going to use this opportunity to just disclose my complex emerging experience to the video as if I'm talking to the client, but I'm not actually rehearsing to say this in session with the client. So I'm just doing this intrapersonal self-disclosure of all facets of my experience. The part that might have an urge to want to change something or persuade the client to do something, and also this emerging part of being attuned. So let's see how that goes. I'm going to open up the video. Yeah, you know, and as you're talking, I can really feel this urge inside of me to want to, at first, want to do something about it, you know, kind of push you to change and to try something different. But I'm realizing now that that would be neglecting what you're saying. It would be neglecting where you are right now. You're saying something so important that you just feel these unmet needs for such a long time, and you're still feeling that right now. And I really feel sad being in touch with that. I can even sense, you know, a little bit of welling up as I'm saying it. And I'm also really, you know, honored to be able to be here with you in this difficult situation. Mm. Mm. Okay, so I'm gonna do the reaction form. That was really interesting. I could really feel myself starting to get moved. And again, I felt a rise of anxiety coming up as I was doing it. I felt myself getting a bit less clear about what I wanted to say. So it felt, again, harder. I think I switched again to being about a 7 as I was doing it, because all these complex feelings came up, and I still feel grounded, but I feel more shaky. So I think I want to try that again.
Great. So, first of all, Alex, can you describe why is it helpful for you to verbalize your inner experience to the video, even though you're not going to, do that most likely with the real client?
What a wonderful question, Tony. I mean, there's a couple of reasons. One of them is that if you were to cognitively ask me about it, I could give you a long theory about my experience with the client, but it wouldn't be actually exploring that experience in the moment, in the here and now, and making sense out of it in the moment. So talking to the client at the screen, it's giving me permission, like a safe space outside of the therapy room, to really be able to explore my own range of emotions and feelings with this client. How that might translate into helping in the session itself is that I will feel less blocked and frozen about any kind of feelings coming up for me. So instead of just having a blurry anxiety with the client, I might feel much more grounded, like, yeah, of course, I feel sadness and grief. I feel this compassion part. I might feel angry, but it gives me the chance to heighten my emotional tolerance so that I can stay more present in session with the client.
Great. Also, Jenny asked a question by chat that I want to read out loud because the webinar, I don't think they can see the chat. She said, Alex, is the video you're watching from a telehealth or in-person session? If telehealth, are you seeing both you and the client or just one client? Can you answer that, please?
Sure. Yeah. So I answered that this is a telehealth recording and the recording is in split screen. So theoretically, I could use my side because I am also there on the one side. For the purpose of this exercise, I'm just looking at the client side of the recording, but you can do amazing, very creative work watching yourself also in the video. So I do, one thing that I do a lot, for example, with particularly tough clients is I do a lot of self-compassion work, seeing with myself directly in the video. Like I'll talk to myself in the video, I'll see feelings towards myself while doing the session, etc.
Yeah, great. Great question. All right, let's do the fifth and final round here. And here we go.
Okay, gonna try round 5, gonna try the intrapersonal focus again and trying to focus even a bit more on my experience and staying with my emerging experience as I'm watching the clip. Okay, so gonna push that. Yeah, you know, I'm noticing that it's really hard for me to stay completely present, aware, and available as I'm hearing you. And that's just really letting me know that I'm also struggling with these, you know, with how intense, how true and how intense it is at what you're saying. And I can notice my own anxiety coming up, my own urge to want to back away. But I can also notice my desire to not do that. That I want to stay here. I want to be available for you. And so I also feel some pride as I'm saying that. And I guess I do want to commit to being able to stay with this, to stay with your experience, stay with my experience. Really make room for that. Okay. Yeah, I mean, each round feels different. I'm at 5 or 6, so it's still a good challenge. But man, like I'm still sensing shifts going on. You know, I think I'm gonna keep doing a bit more of this, have some more rounds of intrapersonal focus to really make room for what I'm feeling. Yeah, this is helpful.
Great. Great. Any questions? Please put them in the chat window. So, what you saw there were 5 rounds of solitary deliberate practice. It started with more of a focus on what to say to the client, and it started kind of higher in the difficulty, like around a 6, 7, and then it pretty quickly got lower and lower difficulty. It got easier. And it might be because the skill is just not that hard for Alex. Maybe it's something he feels comfortable doing with other clients or, you know, that kind of thing. And so he shifted the exercise to focus more on his kind of flushing out his internal process. You could say flushing out his countertransference, his experiential avoidance, whatever you want to call it. And then it got more difficult again. And now the difficulty was coming back down. Does that sound about right, Alex?
Definitely. And maybe I want to share also kind of a pragmatic outcome also from this practice session is that I love using, people I work with know that I love using the thought calendar experiment. Like if you think about your calendar for your week of the clients that you're going to see, right? So which are the clients that you have kind of more emerging reactions? Oh, okay, it's this client today that we're going to see. We all have it. So one very cool thing about continuing the relationship outside of the room, like I'm doing here. I'm continuing the relationship with this person. Is that even that changes. So instead of dreading seeing this client, or at least, being somewhat afraid of how it would be next time, I came out of this experience wanting the next session, wanting to connect, wanting to be there for the client. And I think that's also very valuable, for therapy.
Great.
What is Heidi? Absolutely. Talking to the patient.
Read it out loud for the webinar.
So Heidi is saying, I absolutely love the idea of talking to the patient like this to figure out your countertransference and reflect more. Yeah, I agree. It's been a lifesaver many times.
And we should note, this, like, we didn't invent this. This has been done for decades by different models of therapy. Like Gestalt trainings, psychodrama, there's all kinds of models have been doing this for 50 years or more. What's cool now, the advantage we have now is we have such easy access to videotape sessions. In fact, if you're doing all your sessions by Zoom because of COVID, with client consent, it's super easy to record all of them. So, we just the ability to access this has gone way up. So it's a silver lining of COVID.
I also just want to add that although it seems obvious to say, one important thing to take out of this is that it takes some work and motivation to repeat a practice. So what you saw were 5 rounds. And, we talked in between, etc. But imagine doing one after the other with no stopping. It's actually quite a workout. Even if it's just 10 minutes, let's say, total. There's a part of you that's struggling there. I can definitely tell my part that's struggling there, right? So just to talk about the motivational and the importance of repeated practice.
Yeah, I typically, until I haven't even really done like enough until I want to stop. And that's a sign that I got to keep going. So it's kind of the same if you go to the gym or you're practicing a musical instrument. It typically takes some willpower to continue. So let's move on to the next stage. This is the final stage where Alex filled out the deliberate practice diary form. Now, I emailed a copy of this to all the webinar participants here today, and there's one on our website. And so do you want to just talk us through this, Alex?
Sure. So I did a couple more rounds after this. I didn't record, but I did about 3 or 4 more rounds. So I totaled that 20 minutes for this solitary practice session. I would recommend not overdoing it, meaning like sometimes we have this thing like I want to be a super shrink. I'm going to practice 1 hour every day. God bless you if you're able to do it, but probably better idea to do 10 good minutes or 20 good minutes of practice. So I did 20 minutes in this case. So in the diary form, so you can see there, we want to write what small learning goal did we focus on, why did I pick this focus, what exercise was used, and with what stimuli. This is really helpful to document for yourself your own learning journey. So you can kind of have your packet of like, what have I been focusing on and when have I been focusing on it? And you can send it to your coach, which is really helpful. So as we said before, I first focused on an interpersonal aspect. I wanted to slow down with this client. I want to be able to validate and empathize with him without having to move forward, basically. Move forward from whatever was happening. And then shifted to the intra focus of monitoring and staying with my own complex feelings. How did I pick this focus? While reviewing a session tape, I noticed that one of my clients was triggering me to talk faster and my urge to push the client to try more adaptive behaviors in his life. I believe I need to first anchor more solidly in his current lived experience and process it in order to then move to more change-oriented invitations. So basically, I was starting to move to a change strategy, not because of the client, but because of my own anxiety. So I wanted to slow down. What exercise did I use? So I limited my interventions to repeated practice of validation and empathic evocations. And I used that 20-second clip from the session. So then we write what was helpful or worked in the session. So I'm writing here, each round was challenging, made me more aware of my own urges, gave me a chance to try out interventions I want to do more. By the way, I should say all of this would be impossible if I just thought about the client, right? If I was just by myself writing process notes about the client, I would have never had a bunch of these learning experiences. Tony.
Or if you had been talking about with a supervisor.
Exactly. Good point.
Right? So and I want to really highlight this. If Alex was with a supervisor, the supervisor could have given Alex all kinds of great ideas, but we wouldn't have really found out experientially what was going to work for Alex, what was going on inside of Alex. Yeah. Go ahead, please.
Yeah, that's really important. So also it was very helpful to notice my own complex feelings and the urges and experiential avoidance that I had while with the client, and how this could lead me to relate to the client in a way that was less productive. I now feel less anxious for him, for myself, and for meeting him next session. Yay. I didn't really notice any unhelpful or didn't work category for this particular practice. So I did.
And let me jump in there too, because that does happen.
Oh yeah.
There will be times where I'm doing deliver practice with a client that I'm kind of stumped with, and I just kind of wander and I'm kind of confused the whole time, and I never really figure out a good skill focus. Or a supervisor has given me a skill and it doesn't really feel right, and so don't expect every time you're doing this for it to like feel super helpful. Sometimes it's kind of a work in progress.
And if you're working with a coach, this is also super helpful feedback, like to know what didn't work or what wasn't so helpful.
Yeah, as a coach, it is so great when my coachee, comes to our coaching session and it was like, deliver practice didn't help. I was confused, or it didn't help the client or whatever. And then we can really kind of unpack what didn't work. And then that'll guide us better towards what will work. Because psychotherapy is complex. You know what I mean? This is, we use all kinds of metaphors like sports or music or flying. But I mean, to be totally frank, those professions are very simple compared to what we're doing. I mean, they're very concrete. You can, in all those professions, you can write down exactly what you're supposed to do ahead of time. Like, we don't have that luxury. So we're kind of figuring it out as we go. And so, sometimes it won't work, and we'll use that as a learning experience.
Yeah, monitoring. So we talk about FIT, feedback informed treatment. We can also talk about FIC, feedback informed coaching. So this helps. Every feedback to yourself in your coaching process really helps to tailor it. Okay, and last question. What did you learn about yourself? I love this question. What did I learn about myself? It's so helpful, actually. Current skills and skills you like to keep improving. So I wrote, I need ongoing DP to keep my own anxiety and avoidance from interfering with deeper attunement in session. I want to keep improving my capacity to stay with my clients' unmet needs and honor them without too quickly jumping into problem-solving mode. I love my problem-solving self, but timing is everything, and I want to enhance my capacity to stay with the deeper hurt of another person and cherish it without stepping away. I will for sure do the same practice with this client during the coming week, which I did.
Great. Thank you, Alex. Let me just go back. We're going to be wrapping up in a few minutes, but in our last few minutes here, let's go. Okay, so what you saw here was Alex, a self-directed solitary deliver practice, which can be great, but is sometimes not sufficient. Sometimes you really need help from the coach. So when you're confused about what's going on, sometimes when I'm doing just solitary practice, I get kind of bored, like too bored. I have trouble with motivation, that kind of thing. Sometimes it just doesn't feel helpful. Sometimes I really need a coach's eyes on my video. Like, what am I doing wrong? So these and other reasons are good reasons to have access to a coach. We are going, so the forms that you saw today, the reaction form and the therapist diary form are available on our website. We're always adding new forms. Oh, and we should mention this, that members of the Deliver Practice community, some of whom are here today, are translating the forms into a bunch of different languages. So we've now got forms in at least 5 or 6 different languages. So thank you everyone for doing that. And if you'd like to translate the forms into your language, please let us know. We'd be happy to host them. And there are currently 5 of us available for coaching. Very soon, within a few months, we hope to have many more coaches available. Coaching is a very personalized process. So we've created a certification process so that people can learn how to become coaches. Originally, when people came to me and they said, how do I become a coach? I said, well, just do it and see how it works. And that didn't work so well. So we've created the certification process so we can all kind of agree on common standards for what is deliberate practice coaching and how is it different than supervision, consultation, that kind of thing. So information about all that is available on our website. And finally, a plug for our next webinar, which is in just a few weeks. We've got a series of new deliberate practice exercises for multicultural orientation. There's going to be a whole bunch of exciting resources on this, including an interactive website that we're rolling out over the next few months. And this is the first step. So please sign up through our website. And thank you for joining. If you have any last questions, feel free to, oh wait, there's some questions here just
awesome
before.
Question. Yeah, from Francis here.
Okay, do you want to read it?
Thank you for the shout out to Very Bad Therapy. They are a wonderful podcast for people.
Oh, it's a great podcast. Yeah, definitely listen to Very Bad Therapy. Alex, you want to read the question?
Yeah, so how does solitary practice complement with my supervision? This is a wonderful question. Tony, you want to go for it?
Yeah, so what I typically would do, I have a supervisor who unfortunately I typically have to pay a lot of money now that I'm out of graduate school to look at videos of my tape and be like, oh, you know, this could have been better. Or, oh, you screwed this up or whatever. And they will, you know, point out a list of skills that are typically from a specific model that we both use, or they might be common factor skills. And in supervision, there isn't really time for me to do a whole bunch of rehearsal because I'm really paying for their feedback. You know, I'm not paying for them to sit there and watch me rehearse for like a half hour, right? And then I will take that list of skills and then I will go do my own solitary deliberate practice, right? Maybe once or twice or three times before we meet again with the supervisor. And then when I meet again with supervisor, it'll be like, this worked or this didn't work, or I'll show them the diary form or, you know, that kind of thing. Or the next session of video from the client. Now, this is how people learn, get expertise in all these other models, like other fields, like for example, music. Your music teacher will watch you, give you feedback, but then you'll go practice yourself in a solitary way. It's, you know, when I was learning to fly a plane, that's how I learned that. When you learn sports, is how you learn that. And so this is how it's done across fields. So great question. Let's see. Diane Anderson noted something that I want to highlight here. Hello, Diane. She agreed with Heidi. She said, what a lovely way for treating yourself as a therapist with curiosity and compassion. And I want to really underscore that. It is very, very common that when I am having trouble with a client, for whatever reason, I have stopped treating myself as a therapist with curiosity and compassion. And maybe it's countertransference, experiential avoidance, who knows, parallel process, who knows. But it is very, very common that part of the process of getting unstuck with the client is also getting unstuck with myself. And I don't know exactly why that is, but it's very, very common. So that is something we emphasize in deliberate practice, is finding your way back to curiosity and compassion with yourself. And great, so we should wrap up here. Thank you again, everyone. It's been great having you with us, and please join us for a future webinar.
Thank you so much, everyone. Really great questions.